Hello, beautiful people. Thank you so much for coming to Baby Child and Co once again. Today we are a little late. We have some problems with the sound. And if you join us, can you just put it in the comments whether you can hear clearly, because we are having some issues with the sound. And we have Vera in the studio, and she is our pediatric ophthalmologist who is coming to talk to us about our children's eyes and vision. I've seen one person has joined. Can you just do me a favor and put in the chat whether you can hear me clearly? That is actually why we delayed starting. Okay. The person says they can hear me clearly. So thank God we can go on. All right. So we are talking about our children's eyes and vision. So what I will do is just bend down my head right now and just share to my page. And so if you have just joined us, can you just take a minute to share to your page as well? And anytime you have a problem with the sound, because we were having issues, just kindly put it in the comments and then I can see. So I'm just sharing to my page right now, and then we will kick off. So I am sharing. And great, yes, somebody else says they can hear me Vera on LinkedIn. I just thank God because I didn't want to disappoint anyone. All right, so we will start right away with the things that we want to talk about our children's eyes and vision. So Vera, well, Vera needs no introduction, and I've introduced her severally. I've said, in fact, Vera and I have worked before, and then she decided she wanted to work on children's eyes and not all of children's bodies. She's quite popular for having hosted for a long time Fruits of the Womb on TV. And she has kindly agreed to do this for us. Myself, I think you know me, but if you haven't met me before, my name is Dr. Sarah Mwodri. I'm a pediatrician, and I'm currently at the Red Cross War Memorial Children's Hospital in Cape Town, and that is where we are doing this from. All right. So, Vera, can you tell us how common are eye problems in children?
Okay, thank you, Sarah, and thank you for the introduction. Yes, eye problems are quite common in children. I will not say they are uncommon, but when you take globally all ages, especially with regards to visual impairment in childhood is a small, it's kind of a small factor. So worldwide, visual impairment, we have about 2.2 billion people who are visually impaired. But in childhood, the figure is about 19 million. So just looking at the figures, you may think that it's a very small percentage. However, the issue with children is that because they have their whole lives ahead of them, when you take into consideration the lifetime years they have to spend, then it's really a big problem. Because if a child is visually impaired or blind, it affects their productivity, it affects their career choices, it affects their social interactions for life. So that's why it's one of the priority areas of the WHO when it comes to blindness and visual impairment. So it's a small percentage globally when you look at all ages, but then if you're looking at it in terms of a number of years a person has to live with the impairment, then it's quite significant.
Okay, I see. Interesting. So it's a good thing we are talking about it.
Yeah.
I want to start off with some of the problems that I have seen in the consulting room that parents have come with for their children. The first one is blood on the eyes of newborns. What is it something we should worry about? How do we manage it?
Yes, it can be very scary. Like you have your newborn and you see blood on the eyes. But usually if there's anything that causes an increase in the intraocular pressure or pressure within the eyeball, it may cause the tiny blood vessels that are on the white part of the eye to burst. So, you know, the process of delivery can be sometimes difficult. So in the process of delivery, as the baby is being pulled out and hands are all over the head, sometimes there's compression on the eyeball that can cause these small vessels to burst. and cause what we call a subconjunctival hemorrhage. For most of these newborns, it's not a problem. Within 2 weeks, this blood or this redness you see will clear. However, you need to differentiate this from an infection, which can also give you more of a pinkish eye. Okay, most of the time it will occur bilaterally. We commonly refer to it as ophthalmia neonatoriums, where you have also purulent discharge. Sometimes the discharge may be watery or sticky, so you need to differentiate these two. But if it's just redness, and the eye is quiet, no discharge, and it was noticed immediately after birth, most likely it's just a subconjunctival hemorrhage, and it will clear within 2 weeks.
Okay. That's reassuring, because I mean, parents are quite scared. And I want to apologize because of the sound issue. I got a bit unsettled, and then I was turning my camera. You may have seen that I've turned you sideways, and maybe you got dizzy.
Yes.
But that was what was happening to me, because
Okay.
I spent so much time on the sound that I'm now trying to adjust the camera to something that we can watch and see. All right. So what about in older children, when they are, I've seen children, they are coughing and then they have blood on their eyes?
Yeah, so it's the same mechanism. Anything that causes an increase in intraocular pressure can cause those small, tiny blood vessels. They are very fragile. So anything that causes increased pressure in the eye can cause them to burst. And then you have the hemorrhage. In fact, not only coughing, even when the child is very constipated,
Okay.
and they strain, you can have the same effect. And then you have the blood, you notice the blood on the eye. And in those children, because they are verbal, in older children, they are verbal, at least they can tell you that if it's not painful, it shouldn't be a painful eye. If there's pain, it's not a subconjunctival hemorrhage, it's something else. Probably for trauma or an infection, and you should worry about that. But usually there's no associated pain, no discharge. Most of the time it will resolve on its own, and you need to treat the primary cause. So if it's from a cough, chronic cough, you need to treat the cough. If it's from constipation, you need to treat the constipation. Otherwise they will keep having it. And most of the time, the parents are more worried about the red eye than the primary cause. So when they come to see us, we send them back to you guys.
Okay.
To treat the primary cause.
All right.
Yeah.
All right. Yes. It's very interesting to know that when your child is constipated, the child can also have blood on the eye from the straining that comes with constipation. That is very interesting. Okay.
Yeah.
And can babies see?
Can babies see? Well, yes, they can. They can. In fact, when babies are born initially, of course, they have their vision is not as good as adults, and that's because the eye is still developing. Unlike other parts of the body that are well developed at birth and then just keep growing, for the eye, the development continues until they're about 8 years, where if you take all the structures of the eye, they are just about the same as the adult eye. So at birth, newborns are far-sighted. That means they can see things at a distance, but not things that are very close to them. So the vision is quite blurred. Okay, but then they can still see images. They can see faces, light, things like that. As they grow older, by about 6 weeks, we expect that your baby should be able to at least follow objects. So as if your baby is lying down on, let's say, in the bed and you are moving, your baby should be able to follow your movements as you move from one side of the room to the other. Okay. And even when another thing to look out for is when you are breastfeeding, the baby should stare and look at you. One sign of impaired vision or poor vision in newborns is wandering eyes. And it can be picked up very early. You don't have to wait till the child starts school to pick it up. So you are breastfeeding a baby. As a mother, you need to be observant. Is your baby looking at you? Because the expected thing is that the baby should engage you and look at you, especially from 6 weeks, 2 months, when they start having the social smile. And in fact, the social smile is a sign of good vision for that age, because they identify the face, it's a familiar face, and they smile in response to your smile.
Okay.
So if you have your baby is breastfeeding and the eyes are roaming all over the place, they are not focused, they are not moving in a kind of synchronous movement, it should be a cause of worry, and you should get it checked. As they grow from about 3-6 months, vision further improves. By 3-4 years, in fact, their visual acuity is close to that of adults, and by 8 years, the maturity of the eye is complete in terms of the size, and all the structures within the eye are fully developed. So they should see 6-6 vision, just like an adult's vision.
Okay.
And in
You said
children,
you said something that I don't quite understand. You talked about wandering eyes. What is that?
Oh, so the eyes, so they have a kind of a roving gaze. So the eyes are all over the place. So one eyes are, it's like they're not looking at anything in particular. They are just the eyes are just moving, wandering, just as the word implies. The eyes are wandering, and sometimes there's something we call the oculodigital reflex. They poke their eyes, and
they poke their eyes.
Yes, they actually poke their eyes. So you see them
with the fingers.
With the fingers, and it's thought that it is also a sign of poor vision in babies, and it's thought that they do this to stimulate the eyeball, the retina, the nervous part of the eye. So it's kind of an innate reflex to help stimulate the eye. So when you see these things, these are signs that your baby probably has poor vision, and especially if there were risk factors during the pregnancy, like you had a difficult pregnancy with heart infections, you had a difficult delivery, delayed second stage, baby had to be removed via vacuum, your baby had a NICU admission, you were told baby had birth asphyxia, or baby had neonatal jaundice. If you had any problems during this perinatal period and you notice, in fact, your pediatrician or your doctor should refer you to see an ophthalmologist. But if this isn't done and you realize that at age 6 weeks, 6 to 8 weeks, your baby is not really looking at your face, eyes are all over the place, you need to see an ophthalmologist for assessment.
I see. All right. Some interesting things you have said. But before then, let me just say hi to our friends who have joined us. Priscilla, she gave me the thumbs up that she could hear me. And Paul, hi, Paul, long time. Tate and Bloom has also joined us. And HRP says she's watching us from the US. So thank you so much for joining us. Do share. We apologize for the initial hiccup. All right. So now you have a baby and you have identified what you call the wandering eyes, which means that the baby's eyes are not staying fixed on an object, like it's not staying fixed on your face, or you see that the baby is looking everywhere. The eyes are wandering, as you said, or the baby is poking the eyes. And you've gone to the ophthalmologist. What are some of the things that they can do for you or recommend for your baby?
Okay, so the first thing they will do is to examine. Well, but before that, they will take a history, of course, to look if there were any risk factors. Because before I even go on, just a caution so that people don't get overly alarmed. Yes, babies like to stare, because especially when they get into a new environment, that staring is different. It's a kind of synchronous staring. They are moving their eyes simultaneously from one to another. But this wandering eyes, there's no rhythm to it. The eyes are just all over the place. So it's important that parents distinguish this. But if you're not sure, of course, let someone know. So a history will be taken to see if there are any risk factors. And then a general eye exam will be done. Now, we examine the anterior part of the eye. First, we assess whether they are fixing and following. First, we test with light, and then we test with an object. And if they are able to follow the light at least, then we know that, depending on the age, of course, then we know that at least there is some vision, because light is the least thing that we expect anybody to be able to perceive. If a child cannot perceive light, or if an individual cannot perceive light, it means that the person is virtually blind. I mean, the eye is not seeing anything at all. So we test for that, and then we test with objects. And then we examine to see if there are any um, pathologies in the eye, or diseases in the eye, like cataract, because we can have cataract in newborns. Cataract is not only a disease of the elderly. When I say cataract, what do I mean? So in every eyeball, there's what we call, just like a camera, there's a lens. And it's the lens that focuses the light from the object you are viewing onto the back of the eye, which has a film for you to see. So the eye is just like a camera. Okay. Now, this lens in the eye is supposed to be transparent, but in some people, this lens becomes opacified or clouded or white. And when that happens, we call that a cataract. In adults, it's part of the aging process, but in children, it can occur either from some infections, from some conditions, genetic conditions they were born with. It can happen just sporadically, meaning that there's no cause, it just happened. Maybe as a problem of, as the eye was developing, there was some hitch somewhere. Just like when you have a factory that produces blocks, one of the blocks may come out and have an issue. It's nobody's fault. So sometimes it just happens. So these babies may have a cataract. So we examine for all those, because those can be easily corrected. Okay. And then so that we examine the back of the eye, what we call the retina, or the film of the eye, where all the images are focused onto. We examine to see if there are any abnormalities there, because just like with the lens, you may have some abnormalities. In some babies, you will not find anything. The eye will be absolutely normal, but the baby does not see or has poor vision. And this is because for us to have good vision, you need a connection between the eyeball and the brain. So light moves through the eyeball, and then there's a nerve, which we call the optic nerve, that connects to the brain. So the brain interprets the images that we see. So sometimes the eyeball is normal, but because the brain has suffered some injury or insult during the development or delivery process, so birth asphyxia, severe neonatal jaundice, there's a problem with the brain. So this baby, images are going through the eye, but when they get to the brain is not able to interpret these images. So we call that cortical visual impairment.
Okay. Now, so that brings me to a question someone asked. Someone asked me whether jaundice can cause blindness in babies. It was a question that was put in the chat earlier. And you said it can, but not just because it makes the eye yellow. It must be jaundice that is severe enough to affect the brain.
The brain, exactly. Jaundice that is severe enough to affect the brain. So the main problem is the brain. Okay. If jaundice will affect the eyeball itself, then it may be associated with a systemic condition like maybe galactosemia, where they have cataract as well. Okay. But in both cases, if you pick it up early enough, you can correct it, or you can do surgery to take out the cataract.
Okay, great. Let's talk about glasses, because it's something that is bothering a lot of us for many reasons. Sometimes we don't like our children to wear glasses. We think that when children are very small, they shouldn't wear glasses. And the other thing is that those of us whose children wear glasses, we just keep buying glasses. I mean, we buy them like we buy pencils. So let's talk about glasses. Which children need glasses? And should we be concerned when our children need glasses to see?
Thanks, Aram. So I'm happy you brought this up. Now, when you look at all the causes of visual impairments in children, refractive errors is one of the leading cause, in fact, the leading cause of visual impairments in children. And then we also have amblyopia, or what we call lazy eye.
Okay.
Okay. Now, when I say refractive error, what does that mean? So, as I said earlier, for us to see anything, you need a lens, the light rays from the object to get into the eye, and then these light rays are focused onto the film or the back of the eye, which is the retina. So we are doing a little bit of physics here.
Oh, photography.
Yes. Now, in some people, the focusing power of the eye is either too high or too low. Now, if the focusing power is too high, what happens? It means that it will bend these light rays more than you want them to bend. So that it means that your image will be formed in front of your retina, in front of the film. So we call those people short-sighted, meaning that they can see things that are close to them, but when objects are far from them, they can't see these objects. And or we say they have myopia. Okay, so myopes are short-sighted people. Then we have those whose focusing power is weak. So the light rays get into the eye, but because the focusing power is weak, it's not able to bend the rays and bring them into a focus at the retina. So this bending and focusing occurs behind the retina. So we call these people long-sighted or hyperopia. Okay. Now, we also have a third group. Now, for them, they have an uneven, the eyeball is supposed to be like a sphere, so like a football, the shape of a football. But some people have their eyes shaped like a baseball or like an egg.
Okay.
When we talk about the shape of the eyeball, everybody, I'm sure you all think that our eyeballs are all like an egg or like a baseball. No, we're not talking about just the part that shows. We're talking about the whole eyeball. The whole eyeball is supposed to be round. But in some people, it's shaped like a baseball instead of being round like a sphere or like a football. And because of that, they have two different focusing powers based on the different shape. And so instead of having one place where the focusing occurs, they have different points of focus. And we call those people, we say that they have astigmatism. So we have myopia, hyperopia, and astigmatism. Now, what is the problem with these refractive errors? It means that for all these group of people, they won't be able to see clear images all the time. For the hyperops, those who are long-sighted, they can see things that are far, yes. But when it comes to reading things that are close to them or doing near work, they have difficulties. They may have pain in the eyes, headaches. And so for these children, they may not even notice that they have a problem with their vision. But then they hate homework, they don't want to read. Some parents may think they are lazy, but it's because they have headaches and eye strain or pain when they do their homework or when they have to do anything near. They prefer to play around and all that. They can, you ask them to read, if you ask them to do a visual acuity check, they'll read 6.6, but then they have a refractive error, and it's because they are long-sighted. Now, for the short-sighted people, in class, if they are sitting at the back, they can't see from the board. Then they have issues with handwriting, poor handwriting. Then the other issue is social issues. Now, for those who are very short-sighted, because they can't see afar, some friends may see them in the area and wave at them, and they won't wave back. Not because they are antisocial, but because they didn't see them. People may refer to them as being rude because they don't talk to people. They seem to keep to themselves. But the truth of the matter is that most of the times they are only seeing what is directly in front of them. They can't see you, and all these things may take a while to pick up. So parents need to just monitor their children closely if your child is not performing very well in school, if they have very bad handwriting. Let me tell you a personal experience I had. So my son would bring his homework, and I realized the handwriting was really bad. And then he would write double. So like he's writing that this is the dog, and then he writes that this is the dog again, like double of everything. And I could get so upset. Like, what is this? And it was because he had what we call a strabismus, where a type of strabismus, crossed eyes. So each eye was seeing a different image. So he was seeing double. So he writes what he sees. So when you notice these things, it's always good to see an eye specialist.
So, just for emphasis, can you tell
Yes.
us these things that parents should see and worry about? And before then, let me tell you, I started wearing glasses in secondary school, and the first day I wore glasses, I never knew the world was so beautiful. Like, I stood somewhere and I could see, I didn't know it was possible to see those many things. And I think even after I started wearing glasses, I just couldn't learn to be sociable, because for a long time, everybody had said I was not friendly, I wasn't sociable. So by then I had become so anti, so that I couldn't learn this. And it was amazing. Before then, I used to identify people by their gaits, because I couldn't see their face, by their gait and their height. That's how I always identified when my father was coming from anywhere. But I didn't know I was doing that. When I wore glasses and I saw his face from afar, then I knew that you could actually see people's face from afar. Anyway, so for emphasis, can you tell us these things that parents should watch out for and suspect an eye or a vision problem?
Okay, so from newborn, so wandering eyes, not looking at faces, poking the eye, bumping into objects. These are for the pre-verbal children or preschool children, bumping into objects. For school children, poor performance in school, bad handwriting, writing double, challenges in school, difficulty reading. All those are signs that your child may have problem with their vision. And if your child has bad handwriting, it doesn't mean they're going to become a doctor. It may be a sign that they're not seeing well. So, and when teachers complain, I think that we should take the complaints of teachers seriously, because they are with them most of the time. Okay, and for these refractive errors, they are corrected in children mostly by glasses. A lot of parents, when it comes to glasses use in children, it's really a big problem in our setting, because most parents feel that if the kids are too young to wear glasses, another concern is that if they wear the glasses, they'll be dependent on it. If they wear the glasses, then the eye problem will get worse. Now, what the glasses do not do anything. They don't change the structure of the eye. It's not like a drug you're applying to the eye. This is just something you are placing in the eye to help focus images for your child. It's an appendage. It's not a chemical. Okay. The lens in the glass is it's an optical instrument or object. It's just focusing light. It's not doing anything to the child. It's just helping your child to see better. Now, when you talk about your child becoming dependent on the glasses, it's like saying that the human body has natural oils, right? Yet we all put body cream. We put cream on our skin because we want it to glow. Does that mean that our skin has become dependent on the creams we use? No. Now, when the child wears the glasses, they see better. So they will want to keep wearing it because they want to keep seeing better. And that doesn't mean that they are dependent on the glasses. You are treating the condition that they have. What's the danger? For some children, in fact, they wear it for a while, and then as they grow, the error corrects as the eye, because I told you that the eye keeps developing until about 8 years. So as they grow older and with the development of the eye, some of them outgrow the use of the glasses. They may eventually need it again in adulthood, but for some of them, they are fine. But for those who really need it, with those with high powers, they keep using it because it helps them see better. What are the dangers of not wearing glasses for a child who needs glasses? They may develop what we call amblyopia or lazy eye. Now, lazy eye means that the communication between the eye and the brain is lost because that eye doesn't send clear images to the brain. So after a while, the brain decides not to interact or communicate with the eye. So even after you have corrected whatever was causing the poor vision, because the brain has kind of shut off communication with the eye, the eye doesn't see when you correct with the device. So let's say the child has a refractive error, it's a hyperope, and you didn't correct it. The child is now 10 years, and now you've come to the ophthalmologist, they prescribe the glasses because there's amblyopia. Even when you give the glasses to correct the refractive error, the vision doesn't improve immediately. You will have to, it takes a while for the brain to regain that connection or communication with the eyeball. And especially if it's in one eye, then we have to do what we call patching. So you patch or cover the good eye so that the brain is forced to communicate with the amblyopic or the lazy eye. So that's one of the dangers. And in some children, they never recover from the amblyopia because we picked it up so late. So I would want to make an appeal to parents that no child is too young to wear glasses. What is the goal? The goal is to see by whatever means. And just as you love to see beautiful things, your baby will also want to see beautiful things, will want to see the world. So allow them to see. And there's no age limit for glasses. We have babies who have had cataract surgery. 3 months, we give them glasses to wear. There are special glasses made for them, and it helps them see. And as they grow, then the vision improves because, from birth, the critical period of vision is the first 8 years of life. That is where all the stimulation takes place, particularly the first 2 years. So as visual impulses are getting into the eye, then the eye and brain form more connections, and then the visual development improves. Anything that obstructs this process will cause a lazy eye and make it more difficult to treat or manage in the future. So if the baby has
the whole thing sounds so tragic to me that somebody needs glasses and we don't give the person glasses and then the eye sort of won't wake up again even when you correct it. It sounds so tragic to me.
Yes, some time ago I saw an 18-year-old and his vision was counting fingers at 3 meters, meaning that he could only see 3 meters ahead of him. And this is a gentleman who is in school and he's struggling. And this is because he was a high hyperope. He had a very high refractive error, very long-sighted. And according to relations, he was prescribed glasses when he was much younger, but they thought he was too young to wear glasses.
Oh.
And he finally come when he's 18. When, at that age, everything is kind of set in stone. There's very little you can do.
Yeah.
So having the boy's eyes, physically they look perfect. There's nothing wrong with the eyes, but the eye-brain connection is just not there. So these are some of the issues. And I think that we have to educate other school children because sometimes what happens is that when kids are prescribed glasses when they go to school, then their peers tease them. They call them four eyes, call them call them all kinds of names. So that is also an issue. So there's a little stigma, a little bit in the school. So we need to educate. Maybe the teachers can help with that as well. And if your child is prescribed glasses, boost their confidence. Tell them they look beautiful. Let them pick their own frame and let them wear it confidently. Let them understand why they are wearing it. Otherwise, they will get the glasses. Even for those who agree to get the glasses, some of the kids take the glasses when they get to school, they take it off and put in their bag. So
Yeah.
you need to get your kids on board.
Yeah. Okay. I'm just really happy that we are doing this, because there's so much that I didn't think about and it's coming to the fore. And our viewers are also bringing their comments. Thank you. Amelosi has joined us and she's tagged so many people to come and listen. Thank you so much. And we had a question from, two questions actually from Priscilla. Priscilla is asking, what kind of food can we give our babies to prevent some eye diseases? And then again, she asked about a particular eye drop being sold on social media that they say can make the white, that is used to make the white part of the eye more white. Do you advise their use? I haven't come across it, but maybe you have. So 2 questions from Priscilla. Let's answer that one and then we move on to another question.
Okay, so with the issue of the eye drop, I don't know which eye drop she's talking about, but then yes, there are some eye drops that are given to make the eye white, but those should never be used in children. So as an adult, these are cosmetic things. If as an adult, it's your choice, you want to do this, you can do it.
Okay.
But for children, no. And then talking about eye drops, I'll also recommend that if your child has a red eye or whatever, be careful the kind of drops you put in the eye. I won't even go to the breast milk in the eye. I think, Sarah, you can't do that. Putting of breast milk and sea salt and all that, that is completely unacceptable. But even for over-the-counter drops, some people go to the pharmacy and they are giving steroids, topical steroid eye drops to put on the eye. And then they use it continuously. And this predisposes the children to developing glaucoma. And glaucoma is a cause of irreversible blindness.
So I think how we will just put it is that if your child has red eyes, kindly see a doctor, because you see, it's interesting. There are good pharmacists. There are pharmacies that are manned by pharmacists and they know what they're doing. But usually when we go, we don't ask to see their certificates. We don't know who is there. So because the eyes are only 2, and unfortunately in Ghana, we don't do a lot of things. We won't give you another eye. So I think that if your child has an eye problem, it's just better to go to the hospital.
Exactly.
Yeah, that's what I think. Yeah.
Spot on. So just see an eye care specialist or a doctor, because you don't want to give things that will give you more problems than the problem you presented with. And this is especially a problem for those children who have allergic conjunctivitis and thermal keratoconjunctivitis, because they always have this itchy red eye. And they keep going to the pharmacy and they're given steroids and they keep using it for months and years. And then later they have other problems. Then the second question about what kind of food to give to babies to prevent eye diseases. So for food, for this, if it's a baby, serum is here. And
I won't catch you.
You know, if you do exclusive breastfeeding for the first 6 months, your vitamin A requirements will be covered. But as you wean and they start eating other foods, you need to give them foods that are rich in vitamin A. So the red oils, carrots, tomatoes, and then foods rich in vitamin C and E are also help improve eye health, but especially vitamin A. Vitamin A rich foods are very important.
Okay. So we will take another question that has been pending for a while. You answered it partially, but I mean, let's make it clear. Taste and Bloom is asking, can wearing glasses for a while eventually correct the eyesight?
Okay. So the glasses, when you say correct, so when you wear, it's like it's a temporary solution to a problem. So when you wear the glasses are just providing the additional support that the eye needs to focus light. If with aging or growing up, the shape and structure of the eyeball itself corrects this focusing defect internally, then as they age, then they may not need the glasses. For instance, because in children, their eyeballs are smaller than adults, they tend to be long-sighted. Now, as they grow, so for such a child, if they are long-sighted, as they grow and now the eyeball grows and now the focusing power is normal, they may not need the glasses again. So for that child, yes, they may outgrow the need for the glasses. But if the error persists and they are not able to make up for the defect in focusing, then they will always need the glasses.
Okay.
It's just like needing to put on body cream every day. You know, yes, you have to use it all the time, unless maybe at a point the eye no longer needs it, then fine, they can do away with it. But for instance, for people who are short-sighted, most of the time they will use it, they'll continue using it.
Okay.
So it depends on the severity and the type of refractive error.
Okay.
In some cases, it may correct, but it doesn't mean that they are dependent on the glasses.
Okay.
Where you say that, okay, if I take off the glasses, something will happen to the eye. No, the glasses is helping them see better, and so they want to keep wearing it so they can see better.
Okay. All right. And there was a question that came before we started about brown eyes. So I'm thinking the person is talking about the person says, what's the cause of brown eyes? The eyes are always itching and they are brown. The question was in two parts. And the other one said, what is the cause of a crackling sound when you scratch the eyes? I'm not sure about that, but the brown eyes is a question that we hear a lot and we see a lot of brown eyes. So what's the cause? What can parents do about it in children?
So most of the time for brown eyes, it's mostly allergy. So either allergic conjunctivitis or the more severe type, vernal keratoconjunctivitis. And for these cases, once it's detected, unfortunately, it's not something you can eradicate. So it's managed. You are given some medications, anti-allergic medications to help suppress the itching. And then in a few cases, for very severe cases, you may be given mild steroids. But this shouldn't be used on your own. It will be prescribed by your doctor. Then some lifestyle modifications can also help. So changing up, avoiding dust, smoke, perfumes, all the things that can cause allergies in other parts of the body. Changing pillowcases frequently, beddings. If the child sleeps close to a window, change the position. If that's not possible, make sure that the louver blades are always cleaned. In class, check where they sit. For some of these children, they sit at the back where all the books are kept, and there's dust on the books, and then because they are sitting there, when the books are removed, it gets into their eyes, and then it just causes exacerbation of their symptoms. So if you check all those things, modify lifestyle, it helps. But for most of them, many of the parents get frustrated because, like, you treat and then they come, you give them drops. It's a chronic condition. For some of the children, they outgrow it. By the time they are 3-4 years, it stops. But unfortunately, a number of them it persists. For those picked up early, when they use the anti-allergic medications, the discoloration reduces a bit. In fact, in some cases, it completely goes away, but it will persist in a number of them. But I don't think parents worry about the discoloration. The important thing is the function of the eye, whether the child can see. That's what they should be concerned about, and not necessarily the brownish discoloration. For some of them, there's not much you can do about that discoloration.
Okay, I see. So I have also picked something new. I never thought about children who have itching eyes that gets brown. I've never thought about where they sit in class. That if they sit near the books, it can
Yeah.
it can make their allergy come, so to speak. Because allergy, you have allergy all the time, but sometimes it goes and sometimes it comes. What that means is that the disease is there and it will flare up and then it will go to sleep, sort of. So I never thought about that. So if you have a child have allergies and the child is scratching the eyes, then you have to also watch. You have to watch the many things she said. But a new one for me is, where does the child sit in class? The child shouldn't sit where the books are kept. One of our regular supporters, viewers, whatever, patrons has asked a question. He said, Senan says that some people believe that newborn babies should be introduced to early morning sunlight. They believe it helps the eyes. Would you encourage that?
I'll give a quick answer. No. No.
Okay.
But
All right.
then I must say so, but moving away from newborn babies, but for children in general, just to chip in this, I should have mentioned this when we talk about refractive errors. Now there's something going on now, especially with COVID and the use of tablets and screens. In Asia, myopia is now like an epidemic because they do a lot of indoor activities, very little outdoor activities. Children are fixed and glued to their tablets and their phones. And because of this, it makes them more prone to becoming short-sighted. So parents should watch this, monitor your children's screen time, ensure that they get out, play in the
So
open.
when we talk about screen time, we mean the time that the child spends looking at the phone,
Looking
or
at their
the
phones and
TV,
their
or the
tablets
computer
and
game, or
exactly,
the tablet,
exactly,
even if it's
exactly.
educational.
Yes,
Because now
even for
every child
education.
has a tablet.
Yes, every child has a tablet, and if we don't take care, we are going to have an epidemic like what we have in Asia. Where you take almost a third of the children are short-sighted. We don't want to have that here because in our population we don't like wearing glasses. So we need to monitor the screen time of our children. And then just to chip in something about screening, it's very important to me because, for children, they can't complain. A lot of them they don't even know they can't see well. So it's up to parents to help pick up these problems. So newborn screening, unfortunately, we don't have that routinely done in Ghana. Hopefully, in the future, it will be done. But at least before discharge, if there are health workers amongst us, before a baby is discharged from the hospital, just use a flashlight, examine the eyes, see if there are any. If you see any white patch, discharge, anything abnormal, and then do a quick referral. But as a parent, you should ensure that before your child turns 1, you should have an eye examination by an eye care professional. And in school, when they start school, also before they start school, they should also have an eye screening, see if they have refractive errors. If your child is a preterm, currently we don't have a national retinopathy of prematurity screening program, but there are pilots here and there. But as parents, you should take it as your responsibility to see that your preterm baby has their eyes screened within 4 weeks of delivery. So by the time after delivery, by 4 weeks, ask your doctor that, doctor, I heard that because my child is a preterm, he or she is at risk of some eye problem. Can I get him or her screened? And then you'll be referred appropriately. So these are little things that as parents we can do to prevent visual impairment and blindness in our children.
Okay, thank you. Somebody is commenting about the screen time issue. That's Taste and Bloom. As for the screen time, it really is a problem. I keep talking about it. Lots of people keep talking about it. We really need to have like a strategy to deal with it. I had a question before I take. Yeah, I had a question myself before I take the question on the another question in the chat. The question I have is: can giving knocks to children affect their vision?
That's an interesting one. So, hmm. So giving knocks. So in the first place, I want to encourage giving knocks on the heads of your children. So as much as possible, if you want to discipline a child, maybe the back of the shoulder, the back, you know, but not their head, not sensitive parts. Um, it may not directly affect the vision, but if the knock is hard enough to cause bleeding beneath the part of the brain that controls vision, which is the occipital part, that's at the back here, okay, then it may affect vision. So it's yes and no.
Okay. The
Yeah.
question I have is from Taste and Bloom again. There is this eye ointment put on the eyes of newborns when they are born. What is its use?
Yes. So because in the past we had a lot of infections in newborn eye infections, that's ophthalmia neonatorum. I think as a strategy, a national strategy, the decision was taken to prophylactically give all newborns this antibiotic ointment to prevent this infection, because for some children the infection went on and became so bad and caused blindness, you know. So to prevent that, routinely all babies born receive this eye ointment right after birth. But one word of caution is that sometimes you're given two different bottles, one for the eye, one for the
cord.
cord. Yes, and we've had some cases where mothers mistakenly apply what is for the cord on the eye and come with very bad complications. So just be sure be certain in your mind exactly which one is for the eye and which one is for the cord. If you're not sure, ask that the bottles are labeled clearly for you so that you don't have any mistakes made.
Yeah, I have also seen that not once, not twice. Cord for the eye and eye for the cord, and it can be tragic because you are trying to prevent something, and at the end of the day, and now now for the cord we are using chlorhexidine. If you put chlorhexidine in your child's eye,
right, it's a disaster. Yeah.
All right, so we have a few people commending us. Eme has joined us from Kolebu, says we are doing well, and a few other people have put thumbs up and so on that I have not read. I just wanted to ask you before we go, because I can see that our 1 hour is almost up. When something splashes in a child's eyes, or when the child injures, so injury, different kinds of injury, a splash in the eye, and then something hitting the eye, what should parents do for the child?
Okay, so ocular injuries are quite common in children. In fact, in some countries, about half of all ocular injuries occur in children. So it's a real big problem, and it's the leading cause of blindness in one eye, or what we call monocular blindness. So for chemical injuries, so that's the splash of a chemical, commonly for whatever reason in our setting, super glue. It's a very common problem. Just make sure that you irrigate with a lot of water.
Which means pour water on the eye.
Pour water, a lot of it. And be on your way immediately to the nearest health facility for a referral to an eye care professional. Don't stay at home and apply any drops, go to the pharmacy. No. Irrigate and report immediately. At where you are, your first point of call, they will also do some more irrigation, because that's primary irrigation for chemical injuries is what will save the eye. So that's very
wash the eye and go to a healthcare facility. Wash the eye only with water.
Only with water, nothing else. Nothing else. And you don't touch the eye with you're just like splashing the water in the eye and then report. At the facility, they will also do that before they send to the ophthalmologist. Then for globe injuries, so let's say the penetrating, children like to play with these broomsticks. They use it as bow and arrow. It's also quite a common thing we see here. And they come with a perforation to the cornea, or the front part of the eye. and they get very bad infections. In fact, and most of the outcomes are really poor because they come late. Once your child has an injury to the eye, do not wait till the next day. Report same day, because studies have shown, and in fact, even anecdotally, if you look at cases that have been managed, the earlier the presentation and intervention, the better the visual outcome. If you wait, because the more you wait, the more bacteria or germs, the more germs are multiplying in the eye. And the eye is like an egg. It has a very sterile environment, germ-free. So once that the barrier is breached and it introduces any germ into the eye, then your chances of good vision just keep dwindling. Okay, so the more you wait and the more the germs multiply, the worse the outcome. So once there's an injury, if you rush to the nearest health facility, they will put a shield on the eye and then send you to an ophthalmologist to be seen. Don't touch, don't put anything, don't try to be a hero, just report as soon as possible. And then for healthcare workers amongst us, if it's an open globe injury, don't start anything. Just quickly cover with a shield and refer to the ophthalmologist.
Thank you so much. I have learned so much. And the audience has also been very engaging from Facebook, from LinkedIn, and from YouTube. I'm so happy that a lot of you have joined us. And even if you are watching us on replay, you can still put your questions in the comment section, and I will personally come back and attend to them. And since I'm not an ophthalmologist, I'll refer to Vera as appropriate. So we thank you so much. The 1 hour went by so fast, and there's still so much to say, but I mean, it's a Sunday and everybody wants to take a rest. But I learned a few things. The first is that don't treat your child's eye problems in the pharmacy. I mean, if you have a prescription from a doctor, you can take it to the pharmacy and purchase, but don't go treating your child's eye problems in the pharmacy, simply because our pharmacies, or the people who should police our pharmacies, are not doing their job. In another country, you can't walk to a pharmacy and just buy anything, buy an antibiotic, buy anything without a prescription. So please, don't treat your child's eye problems in the pharmacy. And then I also learned a few new things, especially about when children have eye problems. I learned that they poke their eyes, they are looking, but their eyes keep wandering all over the place, and children are in school and they are not doing well. Some may be because of eye problems. Their handwriting is bad, they won't read, they don't want to do their homework, they may be because of eye problems. Children should be screened when they turn 1 for eye problems. But my experience, what I think is that we actually do not have a lot of pediatric ophthalmologists or even ophthalmologists. If the whole country wants to screen their 1-year-old, it may be a problem. So just have a high.
So they don't need to be seen by. They just need an eye care professional. An ophthalmic nurse can do a newborn screening.
Oh, great! Oh, great!
Yes,
all right.
They are trying to do that. And we have ophthalmic nurses everywhere. We have different cadre of staff that help support management of eye conditions. So ophthalmic nurses, some optometrists are also able to do screening for children. Yes. So I mean, to pick up little things like white pupil. I didn't talk about retinoblastoma, maybe another time. But
it was on my sheet because it's so important. So important. By the time it's passed,
so maybe another time. They can pick cross eyes. Okay, and another children may also have this pointing, so they like their eyes. They always kind of close their eyes when they are looking at things. All those are signs of poor vision, which can easily be picked up by any eye care professional. So it doesn't have to be an ophthalmologist. Anywhere you will find an eye care professional, please. So before your child turns 1, at least they should have had an eye screening. And the pediatricians, you can do the newborn eye screening for us.
We do some of the newborn eye screening. I think after this, I should encourage myself and I should encourage my colleagues to help you more. At least we look and we ask. I encourage tears. So just as we're about to close, a question has come in, and I want us to answer it before we go. Please, what routine eye care would you recommend for a child with sickle cell disease?
That's a wonderful question. So, like in the first few years of life, they have the same problems as other children. So, if they could do newborn before age 1 and then before they start school, okay. But then when they turn in the adolescent age, especially for those who are SC, that's when they tend to have the changes or complications associated with the disease at the back of the eye, which we call the retina. So when your child turns between 11 and 13 years, they should have their first fundus examination. So that means the examination of the back of the eye. So don't go to an eye clinic where they are testing for glasses and then let your child just read and then they do. No, we are talking about examining the back of the eye, the retina. So that one has to be done by an ophthalmologist.
Okay, all right. So thank you so much. And we are drawing the curtain here, but we will be sure to bring Vera again because this is so educative, this is so interesting, and I have learned so much. I hope you have learned a lot as well. And just like I was saying, if you are watching us even after the show is over, kindly put your questions there, share, thumbs up, tag people so that they can watch, because we are doing this so that it will make an impact. And if you don't share, then we are not making an impact, and that is not what we want. And thank you so much, Vera, for the time, and hope to see you again. Thank you. Bye.
Thank you too, and kudos to you. You're doing an amazing job.
Thank you. Thank you. Bye-bye.
Bye.